Hi friends, welcome to Nursing Jellyfish. Today let's see the important question paper for Promatric, Haad, DHS, NCLEX, MOH, all the nursing competitive exam preparation. Let's see the questions. First question. A patient with chronic obstructive pulmonary disease is admitted to the hospital. Which of the following intervention is most appropriate for this patient? It is option A, administering high flow of oxygen. Option B, encouraging deep breathing exercise. Option C, restricting fluid intake. Option D, providing a high protein diet. So what is the priority you have to give for the patient? It is the patient was admitted in the hospital. It is okay. That is also COPD patient. It is okay. So what you have to do? The first priority is what is that? It is. So you have to tell the patient to encourage deep breathing exercise. That is, you have to tell the patient to do the deep breathing exercise. That is a priority. Afterwards only we are going for the oxygen therapy. Okay, fine. Next question. If you like this video, please like and subscribe our channel, and also follow the Nurse Genius app and Telegram channel and WhatsApp channel. You are having the more questions paper. Okay, fine. Next question. Which of the following is the primary goal of palliative care? It is option A, cure the disease. Option B, provide comfort and improve the quality of life. Option C, prolong life at all cost. Option D, conduct experimental treatment. It is. So what is the priority you have to give for the patient with palliative care? It is. Okay. So palliative care means you are going to give the last moment of the patient is having pain and everything, we are going to give. Okay, what is that? It is, yeah, option B, provide comfort and improve the quality of life. That is, option B will be the correct answer, because we are going to give the geriatric with along with all the care we are going to give in the palliative period. Okay, fine. Okay, move on to the next question. A nurse is caring for the patient with diabetes mellitus. Which of the following is a priority nursing intervention? It is option A, administering insulin as prescribed. Option B, restricting fluid intake. Option C, encouraging bed rest. It is. Option D, providing high fat diet. So what you have to tell the patient if the patient is having diabetes mellitus? So what you have to tell the patient for important nursing priority? What is that? It is, yeah. So whenever it is there, that is diabetes mellitus, you have to administer insulin as prescribed. It is. So option A will be the correct answer. I think you have understood the question and answer. Every question you must read the questions thoroughly 1 or 2 times, then go for the exam. It is. There is more mock test is available in our Nurse Genius app. Fourth question. A 45-year-old patient is experiencing chest pain. What is the first action the nurse should take? Option A, administering pain medications. Option B, assessing the patient's vital signs. Option C, performing detailed medical history. Option D, preparing the patient for chest x-ray. Actually, what is the question? The patient is experiencing chest pain. It is. So whenever any patient is getting chest pain, what is the first priority you have to check? That is a vital sign. You have to check the heart rate and mainly for respirations. What is the changes was there? Temperature, you know that it is when you're touching itself, we come to know. So main thing is you have to check the vital signs. That is why option B, assessing the patient vital signs, will be the correct answer. Move on to the next question. A patient with a history of hypertension is admitted to the hospital. Which of the following medication is commonly prescribed to manage hypertension? It is option A, metformin. Option B, lisinopril. Option C, insulin. Option D, omeprazole. So it is a very easy question. What is that? The patient is having hypertension. So in this order, if you are they were given that easily, we can able to attend. Okay, metformin, you know that is for diabetes. So insulin, that is also for diabetes. Omeprazole, it is one of the ulcer drug. So that means what is that? Lisinopril. So what is the correct answer? Because the pril, metapril, enalapril, there is all the things are coming related to pril. It was related to the beta blockers and alpha blockers. So that is why it is a hypertensive drug status. So the correct answer is answer B. It is. So one more thing, whenever you are giving the hypertensive drug, what you have to monitor? That is heart rate and BP should be monitored. So don't forget to check the BP before giving the drug. It is okay, fine. Next, move on to the another question. During the blood transfusion, a patient develops chills and fever. What should the nurse should do first? It is option A, stop the transfusion. Option B, increase the infusion rate. Option D, that is notify the physician. Option C, administer antibiotics. So whenever we are going to administer blood transfusion, so what you have to tell the, so the patient is having chills or fever, that is what is the immediate action should you have to do for it? That is the patient getting any allergic reactions. So that is why you have to be stop the transfusion. So that is why correct answer is option A. Don't forget, that is option A, stop the transfusion will be the correct answer. Actually, this question they are asking in the parametric, NCLEX, even for an AIMS, RRB, JIGMER, all the type of competitive exam they are asking this question. Even for students also, for it is benefit for you. So that is why very important question for that. Okay, next move on to the another question. A nurse is teaching a patient with asthma about the use of meter dose inhaler. Which instruction should be included in the teaching it is? So the patient is taking MDI. Okay, fine. Okay, what type of health education you are going to give? Option A, hold your breath for 10 seconds after inhaling the medications. Option B, exhale immediately after inhalation of the medications. Option C, use the inhaler only when you have symptoms. Option D, shake the inhaler before each use it is. What should do for that is, what is the correct health education you have to tell the patient when you are using meter dose inhaler it is? What is the correct answer here? Can you say that? Yeah, what do you have to tell? So hold your breath for 10 seconds after inhaling the medication, because after inhaling what you have to do? You have to tell the patient to hold the breath, then only it will be staying in the mouth, it will be going to act in the airway tract. So that is why you have to tell the patient to keep for 10 seconds. Okay, fine. Next move on to the other question. A patient is receiving intravenous fluid therapy. Which sign indicate that the patient may be experiencing fluid overload? Okay, the patient is getting IV therapy, but it is, what is that? Fluid overload. That means we are given excessively. So option A, dry mucous membrane. So what are the symptoms it will indicate? Option B, jugular vein distension. Option C, decreased urine output. Option D, hypotension it is. So what is the correct answer here? Can you guess it? That dry mucous membrane, decreased urine output, and hypotension, these all the things are going to be hypovolemia. That is decreased fluid. Okay, it is not a fluid overload. So the what is the correct answer here? Yeah, jugular vein distension. So the option B will be the correct answer. Okay, next move on to the another question. A nurse is assessing the patient with a suspected UTI, that is urinary tract infection. Which symptoms is most indicative of a UTI it is? Option A, chest pain. Option B, shortness of breath. Option C, dysuria. Option D, blurred vision it is. See, in this feature itself, the question is very easy. You can able to identify what is that. Chest pain, turn of it, blood vision, it won't come. What is the correct answer here? Yeah, dysuria. So that is why option C will be the correct answer for urinary tract infection it is. Okay, next move on to the another question. Dysuria means difficulty in the urination, along with the you will get a burning sensation of urine also. Okay, fine. Next question. A patient with heart failure is on a low sodium diet. Which of the following food should be the nurse recommended the patient should avoid that it is? Okay. Option A, fresh fruits. Option B, processed cheese. Option C, whole grains. Option D, lean meat it is. Actually, the patient is having which one? Heart failure. So you have to advise the patient to take low sodium diet. Okay. The following food should the nurse should recommend the patient avoid. That means you have to avoid. So which one you should be avoided? Processed cheese. That is option B will be the correct answer. That is the high sodium diet will be there. So that is why you should be avoided. Okay, fine. Next question. Next question. A nurse is preparing a patient for surgery. Which of the following actions should the nurse take first it is? Option A, administering preoperative medications. Option B, ensuring informed consent from that. Option C, performing a physical assessment. Option D, teaching post-operative exercise it is. What should do for that it is? The patient is going for surgery. What is the priority of action it is? What you have to do for it is? Yeah, what is the correct answer here? Can you guess it that? Yes. What is that? Ensuring informed consent and get the signature from the consent it is. So that is why option B will be the correct answer. I think you have understand the question and also answered. Okay, fine. Next move on to the another question. A patient with a recent stroke is experiencing difficulty swallowing. What is the best action for the nurse to take it is? Option A, offering the thin liquids. Option B, providing a pureed diet. Option C, encouraging the patient to eat quickly. Option D, administering high fiber diet it is. So what is the best answer it is? The patient is having stroke and also difficulty in swallowing. So what you have to tell the patient to take it is how they can take. Can you take the thin liquids, or maybe if you are taking frequently high fiber, it will be helpful for that. It is nothing else it is. So you need a what is a pure diet it is. That means just like a liquid, semi-liquid, it's kanji type it is. So that only it will be easy to be drink and easy to eat also. So that is why you got to prepare the diet as option B will be the correct answer for the stroke patient it is. Okay, got it now? Okay, next move on to the another question. A nurse is caring for a patient with acute renal failure. Which of the following laboratory values should the nurse monitor closely? It is. What is the condition? Renal failure. Okay, option A, hemoglobin. Option B, blood urea nitrogen. Option C, platelet count. Option D, serum glucose it is. So what you have to take the, what is the main test, lab test we have to do for that it is, what is that it is? Can you guess it? What is the blood urea nitrogen? Because during the renal failure, the urea and the nitrogen imbalance is going to be, urea is not excreted from the body it is. So waste metabolism is going to be deposited in your body, it will increase also. So that is why you have to check whenever the renal failure it is coming, we have to check mainly two things. One is blood urea nitrogen and creatinine allele. It will clear about the kidney function it is. So the best it is blood urea nitrogen now. So the option B will be the correct answer. Okay, move on to the next question. A patient with a leg fracture placed in a cast, what is the most important instruction the nurse should give to the patient? It is option A, keep the cast clean and dry. Option B, exercise the affected limb regularly. Option C, elevate the limb to reduce swelling. Option D, report any unusual sensation or pain it is. Actually, what is the condition of the patient? Leg fracture, they have applied cost of application, that is plaster of Paris. So they have applied for that it is. Okay, it may be the plastic or maybe in the cement material. Okay, fine. Okay, what you have to check for the important instruction the nurse should give to the patient it is. What is the main thing you have to ask from, you have to tell or ask from the patient it is. Okay, clean and dry, affected limb or elevate, what is that it is. So main thing is report any unusual sensation of pain. So it will indicate the tightness of the cast application and also blood circulation is going to be decreased. So that is why you have to tell the patient whenever you are getting the unusual pain you have to tell. So option D will be the correct answer. Next question. A nurse is caring for a patient with chronic pain. Which of the following is an important aspect of managing chronic pain? It is chronic means a long time pain it is. Okay. So option A, administering pain medication only pain is severe. Option B, using a multidisciplinary approach. Option C, encourage the patient to avoid all physical activity. Option D, limiting the patient's use of pain medications. Actually, what type of advice you have to tell the patient? The patient is chronic means maybe 2 years, 3 years, or maybe more than 6 months also. So whenever you are getting more pain, so automatically what you have to tell? You have to take a multidisciplinary action. That means you have to tell diversion therapy, other therapists. If you tell, then only it will be reduced that because we can't able to take more medications for long time it is. So that is why you have to tell the patient what is that. Option B, using a multidisciplinary approach it is. That is diversional therapy, other therapists we can follow it. Okay, got it now. Okay, move on to the another question. Next question. A patient with a wound infection is prescribed antibiotics. What is the most important nursing action when administering antibiotics? Option A, administering the medication with food. Option B, monitor the patient for sign of allergic reaction. Option C, ensuring the patient drinks plenty of fluids. Option D, applying warm compress to the wound site it is. What is the correct option for the administering antibiotic medication it is? See, if you like this video, please like and subscribe to the channel, and also follow on the Nurse Genius app. You are having Prometric, Haad, NCLEX, all the DHS exam available. So kindly prepare for the mock exam also. If you want it is, you can download and see the Nurse Genius app it is. Okay, fine. What is the correct answer here? Yeah, monitor the patient sign for allergic reaction. Whenever you are giving antibiotics, any side effect is coming or not, you have to be monitored. So that will be option B will be the correct answer. Okay, next question. A nurse is providing discharge teaching to a patient with hypertension. Which of the following lifestyle changes should the recommended? Option A, reducing salt intake. Option B, increasing caffeine consumption. Option C, avoid physical activity. Option D, consuming more processed food it is. Actually, what is the conditions of the patient? That is hypertension. Whenever you are giving the BP, that is hypertension, so the patient is having, what you have to tell the patient? What is the main thing you have to advise the patient should avoid that it is? What is that? Salt. So that means what is that? Option A, reducing salt intake will be the correct answer. Move on to the next question. A patient with a urinary catheter develops a fever, cells, and what is the most likely cause it is? Option A, dehydration. Option B, urinary tract infection. Option C, allergic reaction. Option D, fluid overload. Actually, what is the question? Urinary catheter develop a fever and chills. So that means what is that it is? The patient will dehydration or allergic reaction, any fever or nothing else it is. What is that? So whenever you are, what is that? If you are inserting urinary catheter, it will make a cause for the fever and chills. Means what is the indication? That is called it as UTI, urinary tract infections. That is why option B will be the correct answer. I think you have understand the questions. Okay, fine. If you are having UTI, then what you have to do for the next remedy? You have to start the antibiotics. That will be the best remedy for UTI infection it is. Okay. Next, you have to give the care for the urinary catheter also. Though you have to give the urinary tract catheter also, you have to give care for that. Next question. A nurse is caring for a patient who has just undergone surgery. Which of the following is a priority assessment in the immediate post-operative period it is? Option A, checking the patient blood glucose level. Option B, assessing the patient respiratory status. Option C, monitoring the patient's bowel movements. Option D, evaluating the patient's skin turgoritis. So what is the priority of the action you have to do for it? It is actually the patient undergone surgery it is. If the patient undergone surgery means what is the immediate you have to check that it is? Yeah, what is the correct action it is? Option B, assessing the patient respiratory status. That will be the correct answer. I think you have understood all the questions. Next, move on to the another. A nurse is educating a patient about the management of chronic obstructive pulmonary disease. So, which of the following instructions should the nurse include? Option A, avoid smoking and exposure to lung irritants. Option B, increase your intake of dairy products. Option C, limit your physical activity to prevent fatigue. Option D, use your rescue inhaler only when you feel shortness of breath it is. So what is the correct answer for this question? Actually, what is the conditions it is? COPD, what is it? Chronic obstructive pulmonary disease. That means what you will have? You will have a frequently throat irritations and also cough and sputum. Everything will be present for other conditions. So that is why what you have to tell the patient? What is that? Avoid smoking and exposure to lung irritants. So that is why option A will be the correct answer. Okay, I think you have understood all the question and answer. If you like this video, kindly subscribe channel and also follow our YouTube and WhatsApp and Telegram channel. Thank you for watching. All the best for your exam.